Welcome, everyone. I'm Cynthia Weaver with the Evidence-Based Practice Group at the Annie E. Casey Foundation. I'll be your moderator today. We appreciate you being with us for this next installment in our ongoing Leading with Evidence series. I'm looking forward to a lively discussion today from our panelists as we learn more about how new technology innovations are being used to engage and motivate young people through the use of motivational interviewing. The Annie E. Casey Foundation began offering the Leading with Evidence webinar series in 2018. These webinars offer practitioners and system leaders practical ways to immediately apply evidence-informed programs and practices in your work. This information allows you to gain more clarity about how you do what you do. These webinars also offer researchers, advocates, and fellow funders important opportunities to better understand how evidence-based programs and practices can help youth-serving organizations improve outcomes for those they serve. Let's take a look at our agenda. Today, we'll hear from practitioners and system leaders about how and why and to what benefit they've used new tools for motivational interviewing. Our panelists will also share lessons they've learned as they use these new tools and as they navigated the process of expanding MI across their organizations. And we'll also hear from the tool developer about how and why they created the resources. As many of you know, MI is a practice that uses specific communication techniques to engage young people and adults. The process helps young people gain a greater sense of self-worth and awareness as they develop into thriving young adults. MI was one of the first practices with enough compelling evidence to be authorized on the federal Family First Prevention Services Act, the Title IV Waiver Clearinghouse list for organizations that serve youth and families involved in child welfare. As a result, in child welfare settings, implementation of MI can be supported with these federal dollars. Today, you'll also learn how technology solutions are supporting equitable access to training and coaching in MI for staff across a very wide variety of professional roles and service delivery settings. So let's introduce you to our presenters today. We're excited to host a panel of folks who've created the new MI coaching tools and also folks who have been using the tools in the real world of practice with young people. Let me extend a warm welcome to Mike Tanana, Chief Technology Officer from Lyssn, Angela Watson, Director of Evidence-Based Implementation for Covenant House in New York, Eli Hernandez, Training Coordinator for Covenant House, New York, and Gineste, Data Scientist for the Washington, D.C. Child and Family Services Agency. Next slide, please. Before we launch into our learning journey this afternoon, let's take just a few minutes to go over some important housekeeping details for the webinar. After we hear from our presenters, we'll have some time for your questions. We'll keep our attendees on mute throughout the webinar, but you can go ahead and submit your questions by entering them in the Q&A window, which you see circled on the slide. You'll find that window at the center of the bottom of your screen. You can submit a question there to the panelists at any time during the webinar, and then we'll get to as many questions as we can during Q&A at the end of our time together today. I also want to mention that this presentation is being recorded, and the recording and slides will be made available to you via email follow-up from Casey. Please feel free to share these materials with others. Next slide, please. The Annie E. Casey Foundation works to develop solutions to create a brighter future for the nation's children and young people. Casey's Evidence-Based Practice Group contributes to that goal with investments that help take proven solutions to scale across organizations serving young people. Relative to today's discussion, we supported equitable access to MI coaching for staff serving young people experiencing homelessness. As part of the scale up beyond that Casey-funded setting, the tools you'll hear about today are also being used with child welfare involved young people in Washington, D.C. Next slide, please. Next slide. Let's take a look at this slide and consider our discussion today. By scale, we mean making an effective program or practice available to as many people who can benefit from it as possible. We sometimes call that the eligible population. Getting the right person to the right program at the right time for the right reason is a core value we aim to promote on the road to scale. Interestingly enough, this also applies to staff, not just the participants who receive a program. Today, when we think about scaling up MI, we'll be focusing on the second and third paths to scale that you see on this slide, adapting to replicate and paths to expansion. In terms of adaptation, you'll hear how new MI training and coaching tools adapt how staff are trained and also expand who has the opportunity to receive MI training. We all know it's hard to find the time, space, and money to effectively train staff in new practices. Even more challenging is how to engage and support your staff in the process so they commit to making a new technique part of their daily practice. You'll hear from our panelists today about how they're using the new MI tools to adapt to these real-life practice and update dilemmas. In terms of paths to expansion, you'll also hear about how one agency is accessing federal funds to offset costs associated with implementing MI using these new tools, and how some of their next steps focus on expanding MI to another population they serve. Before I turn this over to Mike with Lyssn to tell you more about MI ClientBot and other new MI training tools developed by his organization, I'd like to underscore that these are not just bright, shiny new tech tools. ClientBot harnesses the power of real words, real stories, and real responses from thousands of young people. 5 MI ClientBot youth personas tell us the stories of many. Next slide, please. At this point, it's my pleasure to introduce Mike Tanana, Chief Technology Officer for Lyssn, a healthcare technology company. Lyssn developed the MI tools you hear about today. Mike, before you take us on a tour of the new MI tools, I'm thinking it's a good idea to go ahead and acknowledge the elephant in the room, shall we say? Lots of us are hearing and reading so much about AI these days, and some of it's kind of scary. ChatGPT, predictive AI based on biased data, et cetera, et cetera. Before we get started, Mike, can you clarify for us what is the AI underneath the MI tools we'll hear about today? And perhaps just as importantly, what isn't it?
Thanks so much, Cynthia.
Next slide for Mike, please.
What we are doing at Lyssn is completely different than something like just asking ChatGPT to respond to a question, which is a process that has no guarantees about the accuracy of what you're going to get back. What we have done is trained our system on hundreds of thousands of examples from experts in motivational interviewing to perform very specialized tasks, and then tested its performance compared to humans. We monitor and report on whether the system exhibits any bias on performance of these tasks. As a result, we have really strong guarantees on the accuracy of the feedback that the Lyssn system delivers. So before I begin, it's worth taking a second to actually describe what motivational interviewing is. Motivational interviewing, or MI, is an evidence-based strategy for helping people really listen to you without forcing their own opinions or judgments. And it works. There's a lot of evidence showing that this method of engaging youth really creates change, meaningful change, and change that's been demonstrated in hundreds and hundreds of studies.
And so Mike, if I could jump in just one sec before you go to your next slide, as we as we talk about what this AI is and isn't, I want to make the point to folks, and we'll try to make this again several times. With the MI ClientBot tool that you'll be hearing about today, youth are not directly interacting with ClientBot. The folks who are interacting with ClientBot are the staff who work with young people.
That's
Next
right.
slide.
Right. One of the key things that we believe at Lyssn is that we are not looking to replace providers, that we're here to enable them to better provide what they do best, which is, empathic human interactions with other people.
Thanks, Mike. Next slide for Mike.
So for years, we've been training machine learning models to automatically identify the key ingredients in motivational interviewing, essentially using technology to rate the quality of this intervention the way that an expert human would. After years of development, AI can now rate most aspects of a practitioner's use of MI as well as a human expert. But it can accomplish this automatically and at scale immediately. AI is doing what MI trainers used to spend hundreds of hours of doing, coding a practitioner's individual MI session by hand to provide coaching and feedback. This automation can help systems and organizations expand equitable access to MI training and coaching for staff across a wide variety of roles. In recent years, we've also added this kind of automated rating to other evidence-based treatments like cognitive behavioral therapy. At Lyssn, we're committed to the ethical development and use of AI. This means that we regularly validate our systems against human performance, comparing our model performance with different race ethnicity subgroups, and we share all of this data with our customers. The Annie E. Casey Foundation funded one of our very first pilots using this technology in the real world with Covenant House of New York. We use the system to provide feedback and training in motivational interviewing for staff across a wide variety of roles at Covenant House of New York. As you'll hear from Angela and Ellie in a bit, they are the largest provider of homeless services for youth in the city.
Next slide, please. Thanks, Mike, for setting the context for the webinar. Now, let's give folks a closer look at these technology innovations. Next slide, please.
So why did we develop this technology-facilitated system for training and monitoring MI? For decades, psychologists have been creating effective interventions for problems like substance use, health behaviors, and homelessness. Because of limited resources and how we do training in our systems, we've only really been able to disseminate these trainings for these effective treatments to a really narrow group of professionals, typically licensed clinicians. But the need for these interventions is much greater than this narrow slice of people that we've been able to reach using traditional training strategies. We believe in creating a system that can democratize access to these interventions, not just for clinicians, but for child welfare caseworkers, for parents, for correctional staff, for the person answering the phone when you call for housing support or job training, or the person working at the front desk at a homeless shelter. So today we're going to share two of these MI-related examples of how we've packaged our technology to enable this kind of large-scale training of motivational interviewing. So the first one is Motivational Interviewing ClientBot. This is a simulated practice environment for MI used by Covenant House. MI Trainer is an end-to-end motivational interviewing training, practice, and monitoring system that's used by the District of Columbia's Child and Family Services Agency, among others. So the next slide. So this is the first tool that we're talking about. This is the Motivational Interviewing ClientBot coaching tool. So this is an app-based program where you have a chat with a simulated client over text, and you receive immediate feedback on your use of MI skills. So if you go to the next slide, you can see what this looks like. So first, you select a youth persona that you want to practice with from a list that was developed based on extensive interviews with Covenant House staff, as well as coded recordings from their real life MI interactions with clients. These conversations are dynamic. They change every time that the user interacts with each persona, just like interacting with a real person. If you go to the next slide, you can see that while you're chatting with the simulated client, you get prompts to practice MI skills, as well as immediate feedback on your use of each skill. For example, if you're having trouble using open questions, the system says, try using more open questions that begin with words like how and why. But this is all in the context of a real-time conversation. So you're basically just chatting with somebody, but you're getting this skill feedback that's shaping your behavior and sort of gradually moving you towards an expert use of motivational interviewing skills. So if you go to the next slide, beyond just training, one of the really exciting problems that we're addressing here at Lyssn is something fundamental about the nature of behavioral interventions. At their core, these interventions boil down to a conversation. And it's difficult to the point of being nearly impossible to relate what is happening in those conversations to outcomes that really impact children, families, and clients. Lyssn created solutions that allow providers to easily monitor and improve the quality of those conversations in a way that can be done at a larger scale. The Lyssn platform can rate the fidelity of a behavioral health intervention. And by fidelity, we just mean the degree to which the practitioner performed the skills essential to the interventions like MI. Our platform can take a simple recording of a conversation between a client and a caseworker, a practitioner or a youth worker, and turn that into a recording with 70 different quality metrics that impact outcomes. We use those metrics to improve the MI skills of the practitioner, case manager, and youth worker by giving them immediate feedback on their use of MI. And we've been using this technology with the District of Columbia. This technology allows us to monitor evidence-based treatments at scale. In other words, we can analyze the use of MI skills in the real world, outside of just a training setting, and give administrators insights for areas of improvement across their entire system of care. Finally, we can use that same platform to automate the documentation process that is a core source of burnout among MI practitioners. One of the more tedious tasks that caseworkers or therapists has to perform is just summarizing the conversation that they have with the youth. We can actually just write that first draft of this for them, since we've analyzed the entire interaction itself. In short, we think that this platform is going to enable a new way to develop a workforce that can more effectively address the needs of children and families at a scale that goes way beyond the classical model that only allows for a narrow slice of licensed providers to have access to these effective skills.
Next slide, please. Thanks, Mike, for that closer look at the new MI Tech tools. At this point, it's my pleasure to introduce Angela Watson and Eli Hernandez with Covenant House, New York. Covenant House has been a Casey grantee since 2019, and they've been a key partner in the MI project, working with Lyssn to develop the youth personas for the MI client coaching bot tool that Mike just described to you. Angela and Eli, I know it's a tall order because Covenant House New York provides so many services, but please take a few minutes to bring our audience up to speed on the work of your organization. Next slide for Angela and Eli, please.
Hello, everyone. Thanks for coming today. Just to give you a little overview of Covenant House New York, we, as Mike said, we are one of the largest providers in New York City, providing services for youth-facing homelessness. So we reach over 1,500 young people a year between the ages of 16 and 24. We have various programs. We've got our fancy, beautiful building near Times Square that is our shelter. And then we have various residential programs throughout the 5 boroughs. and we're open 24/7 every single day. Next slide, please. So some of the work that we do with our young people are, as I said, we provide shelter and then transitional housing, which leads to permanent housing for our young people. We provide mental health and health services. We've got a clinic within the 41st Street location. It's like a GP, general practitioner surgery. We provide, we help our young adults, our young people with education and employment opportunities. We're linked in with various employers across the city, so we can refer our young adults to those services. We have a big youth development program where our youth can come and talk about what's going on for them, what they want to do, where they want to be in, who they want to be in their lives, that kind of thing. And as I said, we've got all our evidence-based models. We try to and do provide the most culturally competent, trauma-informed services for everyone in our community. Next slide, please.
Angela, thanks for giving us that snapshot of the work of Covenant House. I know you provide so many services. It's challenging to do that in a short time frame. Next slide, please, for Christian. So it's now my pleasure to introduce you to Christian Gineste with the Washington, D.C. Child and Family Services Agency. Although DC CFSA is not a grantee of the Evidence-Based Practice Group at Casey, they are using the MI technology tools you're hearing about today in a child welfare setting. Christian, can you give our audience an overview of the work of DC CFSA?
Absolutely. Good afternoon, everyone. It's a pleasure to be here. So the Child and Family Services Agency is the public child welfare agency in the District of Columbia, and we are responsible for improving the safety, permanence, and well-being of children who have experienced abuse or neglect. We currently serve nearly 600 children in foster care, but we also provide services to 1,500 children and their families in their homes. And we do so mainly through motivational interviewing, case management services, as well as referrals to community-based organizations. We also invest in primary prevention through our 11 family success centers that are located in targeted neighborhoods in wards 5, 7, and 8. One last thing I would like to mention about CFSA is that we were the very first child welfare agency across the nation to receive approval from the Children's Bureau to use MI as a cross-cutting evidence-based program as part of our Family First Title IV-E prevention plan. And that was back in September of 2020. And as a result of this, we also became one of the first jurisdictions to contract with Lyssn in order to evaluate fidelity to MI.
Next slide, please. Christian, thanks for that overview of the work in DC and particularly for that overview of CFSA's early role in making MI available to the families that you're serving. So we're going to take about 20 minutes now for our panelists to discuss the experiences of their organizations as they've worked with Lyssn to introduce and begin using the new MI technology tools that Mike is describing to us today. Here's what our panelists will be sharing. Why and how did their organization decide to use the MI technology tools? What barriers to uptake have they experienced? And just as importantly, what facilitators have supported the uptake of the MI tools? And finally, we're really interested to hear about the next steps that they're planning. Angela, Ellie, and Christian, I'll turn the discussion over to you now. And Mike, please feel free to join in as well if you can provide some additional insights or details as the conversation flows. Thanks, everyone. Next slide, please.
So just to talk about how this arrived, how the ClientBot arrived at Covenant House. So back in 2018, we had a champion of MI, and one of our senior managers wanted to bring motivational interviewing to Covenant House. So she started to talk to staff about what this would mean and to explain what MI is about. So we met with everybody and started to bring it in. And then there is always the way with EBMs, with evidence-based models, that somebody always is a champion for a model. So we brought it in. And so we were really invested in the link that motivational interviewing has to evidence-based models. So we were doing it for nearly a year, and then Annie Casey connected us with Lyssn. And so the natural next phase was to bring Lyssn in and to help with the development of the tool of the ClientBot, to help us to train our staff better and to help us to reach motivational interviewing fidelity. So we also wanted a team to help with our work with young adults, and that's to enable them to develop their own skills through MI, with taping and discussions with their supervisors as to how they're doing things. It was amazing to be a part of the development. I mean, we took it slowly, and we're at the point where we are today, which is amazing. We meet every so often and talk about how we're moving forwards through with the ClientBot and the development of it. We wanted to be equitable as well. We wanted equitable access to innovation. So in order to do that, we wanted to make sure that not only are we going to do this with managers, but we wanted the resident advisors involved as well. We wanted to have complete equity so that the RAs are able to work within this and help with their own professional development. So this is how we've got to the point where we are now. Just going to hand over to Ellie. Oh, sorry, not Ellie. So am I handing over to you? Yes.
Christian, yeah, I think Christian is going to tell us about why CFSA decided that they would use the new MI tools. Thanks, Angela, and go ahead, Christian.
Yeah, I think it's fascinating to see the parallels between CFSA and Covenant House, because there are so many similarities. We were also, heavily invested in MI, back in 2020, and originally what we did is we trained supervisors to monitor fidelity to MI. So there was a 2-day training that was really intense, and they had to learn, the different aspects of MI and how to detect, high quality MI during a session with a family. And we implemented that original model in the midst of the COVID crisis. And unfortunately, it was very difficult for supervisors to manage all those different competing priorities and MI fidelity monitoring at the same time. And as a result of those challenges, we received very little data to monitor fidelity to MI. And so we quickly realized that we needed to find a solution that was scalable in the midst of COVID. And that's how we started to learn about Lyssn. So we understood that, it was an AI platform that could actually detect, high quality MI and provide feedback in real time. So we decided to test that platform with social workers, with supervisors, and with our collaborative community-based partners. The feedback that we received was overwhelmingly positive. They told us that the platform was very intuitive. In some cases, some people said that it was fun to use, but they did tell us that they were not entirely comfortable with the idea of using recordings of real interactions with CFSA-involved families. They wanted, a non-intrusive way to monitor fidelity to MI. So that's when we started to discuss non-intrusive ways to monitor fidelity to MI with Lyssn, and we realized that we could actually use their tools in a training environment. So that's what we decided to do. Based on the feedback that we received from social workers and supervisors, we contracted with Lyssn, and we are using their training tools, not only to train but also to get the data that we need to monitor fidelity to MI.
Thanks, Christian. Next slide for Angela and Ellie to tell us about how Covenant House co-created MI ClientBot.
Yeah, so again, my name is Eli Hernandez. I'm the training coordinator, and I helped with this project and continue to help with the project that we have with Lyssn. So the first step in how we co-created was sending Lyssn 100 tapes, real tapes from our real young people at Covenant House and our staff, to help build the AI. So at first we were removing barriers to any uploading. We didn't want it to be a hard step to upload, and so we worked with Lyssn to create a HIPAA compliant folder where we could upload those 100 tapes. So what helped was that our staff understood that final goal. 100 is an easy number to remember, and so we worked at it throughout the year. This was during the pandemic. But folks understood the goal, and we had that buy-in, as Angela said, from our leaders. It was also important that we had incentives for staff as well as we were building this. We were already doing bits and pieces of this, but we had that goal. Folks had the incentives, and it helped us co-create that with Lyssn. Lyssn was involved in more than just receiving the tapes. They were helping us every month along the way, talking through barriers, talking through solutions. It was really important to have their advice and support. For example, they were the ones who suggested the practice snacks. Instead of having folks just do this on their own, they gathered together and did it, or they did it on their own. As the quote says there, kind of on the subway, on the bus home or to work, they could practice using the ClientBot down the line once it was launched. So that's a little bit about how we co-created ClientBot with Lyssn.
Thanks, Ellie, for sharing that. And one of the things I want to make sure that folks understand is that when Covenant House staff were recording these 100 sessions that we're talking about, they were recording real-time MI sessions that I think therapists, right, Ellie, at Covenant House were having with youth who were being served. And then those recordings were coded in a sort of triangulated way, right? So the National Motivational Interviewing trainer, Christine, who was assigned to Covenant House, she was coding those sessions just like they usually get coded by a human. They were also coded by expert MI trainers at Lyssn, and then they were coded by the AI. And I think that's a really powerful part of this story as we think about how MI ClientBot came to be. Thanks for sharing that, Ellie, about how Covenant House co-created ClientBot. Now I think we'll go to the next slide where Christian will talk about how CFSA is using the MI tools, including the larger implementation support platform.
Absolutely. And Cynthia, one of your original questions was about the barriers that we faced when we adopted this platform. As you can imagine, social workers and supervisors already have to use several platforms. Here at CFSA, they have to use our CWIS system. Some social workers use our referral platform. So one of the challenges is to explain why using a new platform was going to make a difference for social workers work as well as for families' well-being. So it did take a little bit of time to make sure that everybody was familiar with the platform, knew how to log in, knew where exactly the training was located. But supervisors played a pivotal role in making sure that everybody within the agency knew about the platform and its impact. And as you can see here on the left-hand side, after 1 year of implementation, 92% of our designated staff and partners in the community have used the Lyssn platform in fiscal year 23. So this high adoption rate indicates that the platform has been accepted by our designated staff, and they are very familiar with it by now. The second percentage that you can see here is the percentage of designated staff who are able to demonstrate high levels of fidelity to MI. And we are currently at 53%. So there is room to improve our fidelity to MI. But if you take a look at the last graph on the right-hand side, you can see the improvements that we have made in the course of a year. So we went from 36% fidelity when we started to use Lyssn, and we are now at 53%, which means that most of our designated staff are able to use MI at high levels of fidelity most of the time. Next slide, please. And I do want to emphasize that, the 53% share that I mentioned earlier is the aggregate level of fidelity. But if you take a closer look at the administrations that are doing the work that we are claiming for as part of our Title IV-E plan, those fidelity rates are even higher. So for our in-home services, we are at 55% fidelity. Our pregnant and parenting youth services are able to demonstrate high levels of fidelity. All of the staff, it's a small staff, but still we are at 100%. And then 69% of our designated staff in our community-based partners are able to demonstrate high levels of fidelity. This is basically what suggests that the Lyssn platform has helped us a lot in terms of improving fidelity to MI.
Thanks for that, Christian. And before let's go to the next slide, but I do want to ask you just a quick follow-up question for you. Christian, when you think about being able to report those fidelity percentages at the aggregate level, I don't know the answer to this, I realize, but is that something that is helpful in your recording for the FFPSA Title IV-E waiver funding stream?
It is definitely a requirement. As part of Title IV-E, we have to monitor fidelity to MI. At the moment, the Children's Bureau has not requested any of that data, but it could happen in the future. So yes, it is really pivotal.
Thanks, that's helpful. So now I'm interested to hear, Angela and Ellie, the next steps for Covenant House in terms of MI and using the MI tool.
Yeah, so one of the goals with really any evidence-based model is thinking about how we can carry and hold on to it internally, having internal coaches, internal trainers, things like that with evidence-based models. So with motivational interviewing, we're looking at becoming self-sufficient, and we couldn't do that without the tools that Lyssn has and we've been using. So that's one of our goals. And as a couple folks mentioned in this presentation, we're really using the tools that we have with Lyssn and motivational interviewing in general as a professional development tool for our staff. And we were talking about recent college grads, folks that are new to the social services field. We're able to introduce them to a really great evidence-based model that they can use in their professional life. The other thing that's interesting here is we surveyed our staff a couple years into MI implementation. We asked them, how's this going? What do you think about MI? And the overwhelming answer was, we like MI. We use it in our personal lives and our professional lives. So this is something that staff saw the benefit of for themselves and for our young people. Again, I want to highlight that it's so important to get folks early on in their careers using an evidence-based model, and like I said, using it for professional development.
Thanks for sharing that, Ellie. And again, I think we can't highlight this enough in terms of ClientBot providing equitable access for staff who really usually do not get training or coaching in MI. I think that is a really important piece of the conversation today. And frankly, one of the things that I think really activated the partnership between Casey and Covenant House, because when your champion came to us back in 2019 and said, we're already using MI, we have a national trainer assigned to us, but frankly, we can only afford to train therapists. And what we realize in terms of the power of MI is that the more consistently all staff are able to engage and motivate young people using MI practices, the more powerful that is. And I think that's one of the innovations here that Covenant House was an early adopter of. And I'm really, really grateful for the work that your group has done with that. And I'm always inspired when folks say, boy, not only do I use this in my professional life, but my personal life too. So, Christian, you were going to tell us about some next steps for CFSA.
Yes. So we are currently considering the expansion of motivational interviewing to a new population. That would be the individuals experiencing homelessness or at risk of experiencing homelessness in the District of Columbia. And so we would be talking about primary prevention. We would be focusing on families who are not directly involved with the agency. And obviously, monitoring fidelity to MI would be extremely important in that scenario as well. And so Lyssn could play a part in helping us monitor fidelity to MI when it comes to managing cases related to homelessness.
Thanks, Christian. That's really helpful and very exciting to hear. So we're doing great on time, everyone. We're going to have some time for Q&A here in a minute, but Mike, I think I'm probably going to go rogue here just a bit in terms of our run of show. I'm thinking about if I were a participant and I were listening in on the webinar today and I hadn't heard any of this before. This is a lot of information. And so I'm wondering, not just Mike, but everybody, all the panelists, feel free to jump in here. I'm wanting to be sure that folks can sort of visualize like what ClientBot is, right? So Mike mentioned that this is an app-based program. So I have a login for ClientBot. Let's just say I'm a resident advisor at Covenant House. I've got my login, I've got my phone, I'm on the subway going to work, I've got my AirPods in, and I log in to ClientBot, and I can choose one of the personas. I don't know, Ellie, give me one. What do they have names? Give me one of
Bo, yeah. You can choose
Bo. Yeah. All right. So I'm going to log in and I'm going to quote unquote talk with Bo. So Bo is bringing with him whatever issues are front and center for him that day. And I've decided to do a practice snack. I don't have a full 50 minutes to interact with Bo. So I'm going to do a 15-minute practice snack. And this is where I want to make the case, the point to folks is, so this is text-based, right? I'm on the subway, got my AirPods in. Bo brings his priority issue to me that day, and I see that on my phone. And then using text, I respond to Bo. So we go back and forth, and he's talking to me, and I'm listening using my MI skills. And then at some point, maybe I veer into advice giving, not that any of us would ever do that, although I have to admit that does sometimes happen to me when I'm talking to young people. So I veer into advice giving, which is not something that we do in MI. And that's where, Mike, you were talking earlier, that the AI under ClientBot might then text me and say, that sounded a lot like advice giving. Could you try that again using what did you say, Mike, a how or a why question?
Right.
And
yeah, and so Cynthia, that's exactly right. You're actually having text interaction, right, with a simulated patient that's really, having a real dynamic conversation with you, right? And it's actually giving you feedback on those actual skills, right? Like, so not just, oh, you need to try more open questions, but it's identifying when you do it right, right? Like, good job, that was an excellent complex reflection, right? And what we found from our research is just that mere presentation of feedback actually does amazing things to shape people's behavior, to increase the use of those skills.
And Cynthia, I want to highlight here, this is something that is hard for supervisors to do with staff. They're not always over their staff's shoulder telling them, hey, try this, try that, do this, especially, again, new people in the social services field. But here we have a program that's able to do that directly, when with no shame, right? You get to practice. There's no one looking over your shoulder. You can say what you want to say and get better.
That's it, Ellie. Thanks for that, because for me, that's what this is. In the privacy of my own mobile phone practice neck, I can practice, there's no shame there, and I can try it again and I can get better. And then something you mentioned earlier, Mike, that I think is so powerful is that the next time I log in and talk to Bo, Bo's not going to bring the same questions with him. Something else is going on with Bo that day. So not only is Bo interactive, but I'm hearing different complex situations every time I log on and interact with Bo. And so I hope that helps folks, because I know we were throwing a lot of information at folks, and I want to be sure that you get the gist of where it is.
And then the training tools that Christian and DC are using are a little bit different, right? Where they're focused on really actually having to say these things out loud, right? So ClientBot is a text-based interaction. The tools that Christian and DC are using, these are where you get patient vignettes, right? And so it's basically simulated patients that are talking about their experiences with substance use or homelessness or child abuse. And you actually practice your responses to those simulated videos. But you do it out loud, and it's recorded, and the whole thing is transcribed, and you get immediate feedback. If you're working on complex reflections, it tells you whether or not you actually used a complex reflection. And if you don't, it gives you some scaffolding to help practice those things. And I think this is an answer to somebody's question earlier. So the motivational interviewing platform that DC is using, the MI Trainer, that's a fully fledged training platform. So Terry Moyers actually has videos that teach you how to do MI, and then you immediately go into practicing those skills. And so you can use that platform as a standalone motivational interviewing training system without having to hire a trainer. Whereas ClientBot is much more of like a practice tool, right? Someone actually went to Covenant House and did a one-time training, and then ClientBot is designed to scaffold those skills over time, if that makes sense.
Yeah, I'm glad you clarified that, Mike. So it's what we're really saying here, folks, is there's sort of like two ways to enter the water, I guess you could say, right? So you can start with a human training and MI, which is what Covenant House had done. And then you can bring ClientBot on as the practice tool that folks can use after a more traditional training. And I mean, I think we all know that, what is it? We retain about 10% of what we learned at a training. And then because we don't really get to practice and be coached, we're pretty much forgotten everything we learned in about a month. So ClientBot is there to help you practice your skills that you learned or that you heard about in the training. And then to Mike's point, there's this much more not complex, but much more comprehensive, I guess you could say, platform that allows, that's where the fidelity ratings come from, right, Christian? I'm hoping you'll jump in here. And I really like that point you made, Christian, that the feedback from the workers in DC was, we're not as comfortable having our actual real-time sessions recorded. Can we do this with practice sessions and record those for fidelity? Did I get that correct, Christian?
That is absolutely correct. And I see that there is a question about whether we still have a traditional training for social workers and supervisors, and we do. So there is an initial training with our Child Welfare Training Academy, but then we have quarterly trainings with Lyssn that reinforce, what the staff has learned during the initial training.
Thanks, that's really helpful. So I was going to move on to a couple of other Q&As, and my panelist and my my close-in colleague here, Ann Haddad, if I'm missing something if I'm missing something in the Q&A, let me know. I want to jump to something that I think we're hearing in quite a few questions, has to do with access to the tools, right? Like, is DC a pilot site? Is Covenant House a pilot site? And the tools are not yet ready for prime time. So let me start with this one, and then I'm going to hand it off to you, Mike. So in terms of funding and sustainability strategies, Casey's goal in investing in this effort is to expand access to MI, to test and demonstrate innovative solutions like the ones you've heard about today, so that others can take them up and get better outcomes on a broader scale. You've heard two good examples today about how organizations and systems are incorporating this MI technology to further their work. And of course, we hope these examples stimulate and catalyze your thinking about how to incorporate innovations like this into your own work, and how to have conversations with your funders about the potential benefits. Shout out to the funders in the audience today. Mike, I'm wondering, since Lyssn is partnering with other systems and organizations in multiple service settings, could you jump in here and maybe give us an example of another site and how they're using the tools and how they're funding it?
Absolutely. So Lyssn is in over 70 institutions that range everything from university-based training clinics all the way to state child welfare agencies. And so, we have several different states and county jurisdictions that are currently using Lyssn under the FFPSA Act to improve their prevention services for motivational interviewing. A good example of this is the state of Utah. They've been using the Lyssn platform for a couple of years now, and as part of monitoring their rollout of motivational interviewing in residential treatment facilities that work with child welfare populations that are using motivational interviewing under the Family First Prevention Services Act. But there are, everything from 988 providers. Those are the providers of the new crisis care line, to CCBHCs, which are counseling centers that are federally funded that have requirements for training and monitoring of evidence-based treatments.
And I'll add on to that, Mike, and I think this is more of a what if thought. Again, as we think about expanding equitable access to coaching in MI, I think it also opens up opportunities to think about where might MI be used that we've never even thought of before. So, back to what Mike was talking about earlier, what is MI? Well, MI is a way of engaging and motivating young people. It's a way of communicating with young. It's not a program. It's a way of communicating with young people so that they feel heard, they feel understood, and it's a way to really help them become the protagonist of their own story. And so I often think about other settings where youth workers are interacting with young people on a daily basis, how great it would be in youth development programs, for example, if staff were able to access just ClientBot. Maybe the fidelity piece is not important there. Maybe the first way to enter the water here in other programs like youth development programs would be to start with ClientBot. So I just throw that out for folks to maybe catalyze some thinking there. One of the questions we've gotten, and I know we all wonder about this, it's hard not to right now. Mike, is AI going to replace humans who work with young people?
We at Lyssn really believe that there's something special about an empathic human being listening to another person. And so we, as a company, are never looking to replace the human in that equation, but really to enhance the skills of the human, right? To make them more empathic, to teach them how to use listening skills more effectively. And so we don't really think that we're going to use AI to replace humans, but we want to expand how many humans are able to do that empathic listening, to do that active listening, right? And we want to make it so more people have access to a human who knows how to listen, who knows how to help them. And so that's really the mission of what we're here to do.
And it was at the very beginning at Covenant House, myself included, I have to admit, we were a little bit kind of skeptical about all of this. And is this going to, the question did come up at a meeting, is this going to replace social workers, therapists, etc.? And then, as Mike said, as we started working with Lyssn, we realized that, it's got to be an empathetic human being to do this. So that was one of the barriers at the beginning that we experienced at Covenant House.
And I think we all, like we said earlier, elephant in the room, right? We all are wondering about AI. I think a couple of questions I saw that sort of revolve around this idea of if ClientBot was developed using the scenarios from Covenant House, where young people are experiencing homelessness or unstable housing, and then, as Mike pointed out, was originally seeded by college students experiencing substance abuse, how are these relevant to child welfare, or how are these relevant to juvenile justice? And I think the answer is sort of a yes and there. I'll go with the yes and you go with the and, Mike, which is that, young people experiencing homelessness come to their session with all the challenges and issues that young people in other systems bring with them. In fact, that's one of the reasons that Covenant House was such a great partner in this, is sadly so many of the young people there are dual involved with child welfare or juvenile justice. So, and Mike, the and is?
When it comes to dually involved youth, they have similar treatment paths. They involve similar populations, and they're really, it makes sense that we're using this funding in creative ways, where FFPSA funding in particular is trying to get motivational interviewing in all sorts of settings, right? Because if a parent has substance use issues, that's not just a substance use issue. That can potentially be kids that end up in the child welfare system. It could be kids that end up in the juvenile justice system. And so, really making these interventions more broadly available, it can benefit, youth in just a variety of different settings that we think of typically under the housing of health and human services.
Exactly, particularly as we think about well-being as our ultimate goal, and the need to engage and help youth feel understood and heard. So I want to be mindful of time. It was so great to spend some time with our panelists today. I so appreciate you being here and appreciate all of you joining in. I know you all have busy schedules. Hopefully we've activated your interest in learning more about this technology, how it can be leveraged to expand equitable access to evidence-informed practices like MI. Please feel free to reach out to any of today's panelists with follow-up questions or comments. Of course, you're always welcome to reach out to me directly, Cynthia Weaver with Casey. I will let you know that our next Leading with Evidence webinar will take place in February of 2024. We'll be featuring a new Healing from Violence scale. It will be available in March in an open source format. We hope that the rest of your day is a great one, and thanks for joining us, everyone.